I'd like to thank Wendy and the Maine Health Access Foundation and Chip and the Chamber for hosting this event. First of all, I don't think I've ever heard a better ad for brokers and accountants than what we've heard for the last 40 or 50 minutes or so. It is extremely confusing. Small employers in particular are challenged. You've got fundamental decisions. Do I offer coverage or don't I? And you've also got impacts where offering coverage could be hurting your lower income employees, but not offering coverage could be hurting your higher income employees and your managers and yourselves. So there's a lot that needs to be balanced. The decisions are very personal. You know, if you've got a 10, 20-year relationship with a broker, lean on them. If you've got a relationship with your accountant, lean on them. Make sure you're making the right decisions for yourselves and your employees. So first off, we are ready to help you. We have been preparing for this for 3 years, and to say that it has been a little bit bumpy to begin with is an understatement. The enrollments on the individual exchange are occurring. It did not go as perfectly as one would hope, but we are getting there. Folks have coverage. Folks are getting benefits. You know, what we saw in our small group market was an exodus. A very large percentage of our small group business actually changed their renewal dates to December to put off those decisions. Now, that doesn't mean that a group that renewed in December can't now change their renewal date to whenever they want. Really what it amounts to, again, is to sit down with your broker and see whether the changes caused by the Affordable Care Act have a positive impact on your premium or a negative one. So it certainly makes sense for employers to take a look at what their premiums would be, even if they did switch to a December effective date. So as Mitchell mentioned, you know, you do have choices. Continue with your fully insured plan, buy a plan through SHOP. Now, as folks mentioned, the SHOP viability is limited right now. If you want a SHOP plan, you need to come through your broker. You can come through your insurer. We've sold several groups already on SHOP plans, not technically through SHOP. You know, the vision of SHOP was a good one when it was first laid out. It would give employers the ability to choose between multiple carriers, employees to choose between multiple carriers and multiple plan designs. That was backed off, and then they backed that off to one carrier. Then they further backed that off to one plan design. So as an employer, where you may have some flexibility in the number of plan designs that you offer through your current carrier, if you go through SHOP, it's one plan design through one carrier for 2014. Then lastly, you can stop offering coverage, group coverage altogether, and allow your folks to go purchase either through the exchange or off exchange. And from our perspective, our plan designs, our individual plan designs off and on exchange are identical. We didn't differentiate between them. All of our group plans feature a wide variety of wellness and other benefits. A 24/7 nurse line, I can tell you this is one of the most underutilized benefits we have. I can tell you that when I was my kids are now, one is getting ready to go off to college. I'm absolutely shocked about that, but I don't know how she got so old and I stayed so young. But when we were young parents, we utilized this nurse line. Well, first we utilized the maternity ward. They told us, hey, you know, call us if you have any questions about the baby. We kind of used them as our help desk, and they got sick of hearing from us. So we started using our nurse line. The reality is one of the most expensive places to receive care is the emergency room. And a 24/7 nurse line allows you to appropriately use the emergency room. Say it's a weekend and you've twisted your ankle and it's swelling and you want to know what to get for care, you can call that line. If they think that the emergency room is the appropriate place for you to present, they'll suggest you go to the emergency room. In the case of a really serious emergency, not only will they recommend the emergency room, they'll call an ambulance for you and wait on the line until that ambulance arrives. Some other We've got a wide variety of disease management programs Also, significant care. So if you've got someone who's got multiple morbidities, say that they're in need of a transplant of some kind, they're going to be given a case manager who's going to help them make sure that they're maximizing their benefits and also getting the appropriate care in the appropriate setting at appropriate costs. Our new plan designs for 2014 feature a wide variety of benefits that we've not offered in the past. Incentive programs. So if someone, for example, is a diabetic, and let's say that diabetes is uncontrolled, and we determine that they would be a good candidate for a diabetes management program, we're going to give them $300 a year if they agree to participate in that program. Likewise, if someone is diagnosed with a pregnancy, and they're and they decide to join our Future Moms program, they're going to receive an incentive of $200 per year. And then we've got our Healthy Lifestyles Online program. Healthy Lifestyles Online rewards folks for living a healthy lifestyle, exercising, eating well, and that can amount to $150 a year in incentives. Additionally, we have a tobacco-free certification incentive of $50 on some of our programs, as well as a gym reimbursement, a fitness club reimbursement. Now, some of the questions that have come up about fitness clubs, what about yoga studios? Yes, they do count as a fitness club. The key is that it has to be a staffed fitness club. So some of these 24-hour fitness clubs where your attendance is not actually tracked, those would not count toward the fitness club reimbursement, because what happens in order to get reimbursed, you need a signed affidavit from it's a form that we provide you that says, yes, this person has been attending the gym. Now, we are offering 3 different plan designs on shop. On the top of this page are the products that are offered in the southern part of the state. The southern part of the state we define as Androscoggin, Cumberland, Franklin, Kennebec, Knox, Lincoln, Oxford, Sagadahoc, Waldo, and York counties. And in the northern part, so those are HMOs plans, so folks know about HMOs. You have a primary care physician and you get referrals. And in the northern part of the state, which is Aroostook, Hancock, Penobscot, Scottsdale, Somerset, and Washington counties, we have a point of service plan. Still required to get to choose a primary care physician, but not required to get referrals. I'm not going to go benefit by benefit over these plan designs. I urge you to work with your broker to take a look at plan designs and see what works for you. But we are offering them at the 3 metal levels. Not a lot has been said about the metal levels today. Bronze, silver, and gold. Bronze plans feature an actuarial value of between 58 and 62%. What that means is on an average claim, the plan's going to pick up anywhere between 58 and 62%, and the member will be responsible for the remainder. That's generally how actuarial value is calculated. Silver plans are 68 to 72% actuarial value, and gold plans are 78 to 82% actuarial value. There's also a metal level called platinum that neither our company or Maine Community Health Options is offering at that metal level. So with Anthem in the small group market, you have a variety of plans available to you. We have 2 different suites that are offered under the name Employee Elect. Very creative naming. We called one Employee Elect 1 and the other Employee Elect 2. What Employee Elect does for you, it allows you to get the benefits that a large employer has enjoyed for years while being a small employer. Employee Elect 1 has 8 different plan designs. You could conceivably offer your employees a choice of 8 different plans. Normally our employers offer between 2 and 3 plan designs to their employers, but if you chose to, if the person administering the benefits wanted to take that on, they could in fact offer 8. And Employee Elect 2 has 10 different plan designs to choose from. Those plans include HMOs, point of service plans, PPO, which is a preferred provider organization, and HSA qualified plans. I will say that HSA qualified plans are clearly the most popular plan designs that we're offering today because of the positive tax implications of the health savings account. So again, as I mentioned, be sure to speak to your broker about what plans to offer and whether you would benefit by offering a multi-plan design suite of products. Another plan that we've been offering since 2007 is through a partnership with the Maine State Chamber of Commerce Purchasing Collaborative. It's Chamber Blue Options. And Chip has many of his employer groups that are members of the Chamber are actually enrolled in Chamber Blue Options. So in order to access this suite of products, you have to be a Chamber member, and you also have to be a member of the Maine State Chamber Purchasing Alliance. And again, for more information, talk to your broker. You can also talk to Chip at the Chamber, or you can talk to the State Chamber as well. It does, thank you. That was Ginger, one of our brokers, pointing out that there is in fact a lower participation threshold on the Chamber Blue Options plans. Our normal threshold for participation is 75% of eligible employees. Under the Chamber plans, it's 60%. Now, the Affordable Care Act has in fact created a little known and little discussed group open enrollment period, and it somewhat aligns with the individual open enrollment period. Last year, or for 2014, that open enrollment period was November 15th through December 15th. So basically, groups enrolling for January 1st effective dates during that period do not have participation requirements. But throughout the remainder of the year, participation requirements are imposed. And again, as Ginger mentioned, the Chamber plan has a lower threshold of 60%. So we are offering what are called Anthem guided access plans, and this is what Mitchell referred to. These are network-based plans that through our partnership with MeHAF, we're able to offer lower premiums because of greater discounts that we've negotiated with MeHAF. So basically, the state is broken into two halves. We've got the northern part of the state, which is a point of service plan. In the north, it's our regular network. It's our normal network, includes all the hospitals in the north and the vast majority of physicians as well. In the southern part of the state, we have a focused network. That network includes the following. In Cumberland County, it's Maine Med and Midcoast. In Androscoggin, it's St. Mary's. Oxford, it's Stevens Memorial. Franklin, it's Franklin Memorial. In Kennebec, it's Maine General. Knox, it's Penn Bay. Lincoln, it's Miles Memorial Hospital. Waldo, it's Waldo County Healthcare. And in York, it's Southern Maine Med. Well, and this slide needs to be updated with Goodall now being part of Southern Maine Med. And it also includes Intermed and Martins Point, which are two of the larger independent physician practices. Now, another piece that's been quite confusing for employers has been the requirement of a pediatric dental, and the word requirement is a loose one. There is some debate over whether it is required or not to have a pediatric dental benefit. On SHOP, in fact, there is no pediatric dental benefit requirement. Off SHOP, there does appear to be one. However, there is no penalty for not having a pediatric dental benefit. So there is some confusion, but the important thing to know is if you don't offer a pediatric dental benefit or any dental benefits at your business, your employees have the ability to go on exchange and buy on exchange or off exchange and buy limited pediatric dental benefits and family dental benefits. Again, I'm not going to go over this eye chart in detail, but there are two different levels of pediatric dental benefit, and I know that Christine from Delta Dental is going to go over the pediatric dental benefits in a little bit more detail, so I won't do that for you. But suffice it to say that, again, another good conversation for you to have with your broker is pediatric dental benefits and those requirements. So before I hand it, and who am I handing off to? Mitchell? To Kevin. Before I hand it off, are there any questions? Yeah. The question was, how do you implement not having spousal coverage in your plan? It's actually fairly easy. You choose not to have spousal coverage. If you have if you've got an employee handbook, you write that into your employee handbook. You inform your insurer that you're doing that. You need to do that at your open enrollment opportunity to make that change in eligibility. But there is some question as to what the duration of that is, and I can tell you that the language in the Affordable Care Act appears to only allow this for a limited period of time. So that's something that you're going to want to dig into a little bit. I believe it's only through 2015, a transitory period, but that's got to be clarified just a bit. That is certainly an option that that folks are considering is employee-only coverage or employee and child coverage, not non-spousal. Okay. Great, thank you.